Welcome to a discussion about payer responsibility. First, we're going to talk about Medigap, which is a supplemental insurance for Medicare beneficiaries. It is intended to cover the gaps specifically. If you'll notice, this is the CMS website, and Medigap policies are particular standardized policies which must, of course, follow federal and state laws, but they are clearly identified as Medicare supplement insurance. These are not second insurances, but are actually intended to be supplemental to the Medicare plans. Sometimes they cover additional things which are outside of Medicare proper. Individuals who are beneficiaries can buy their own Medigap plans, but the thing that makes this difference from secondary insurance or a second insurance is that it won't cover any dependents or spouses. So a Medigap policy is specific to an individual patient or individual Medicare beneficiary, as they're called. Okay. Now let's talk about coordination of benefits. This is a particular excerpt from the Magellan Health National Provider Handbook on Coordination of Benefits section. And coordination of benefits is an industry standard practice to identify the share of costs between different payers. So as they say here, two or more carriers when a member is covered by more than one health benefit plan. So most provider books will have some version of this, although the particular verbiage might be different. We've chosen to use this one because it is very clear. Note here that under COB, or coordination of benefits, the benefits of one plan are determined to be primary and are first applied to the cost of care. After considering what has been covered by the primary plan, the secondary plan may cover the cost of care up to the fully allowed expense according to the plan's payment guidelines. So hopefully you've noticed that this is different from Medigap policies because Medigap is intended to cover the remaining of Medicare. This has already said that a second insurance, which this is, may not cover leftover amounts, but will only cover up to what the first insurance allows. In the next section of the coordination of benefits area, we talk about non-dependent versus dependent rules, active and inactive rules, and then the birthday rule. We will talk about the birthday rule in another session and actually take an example to identify a child. But as we see here, the non-dependent or dependent rule is the first rule governing the order of benefit determination. And you can see here it's the plan that covers the individual as an employee, member, or subscriber, which is the primary plan used for payment, before the plan in which the individual is considered a dependent. And what that means is if a person is on a plan under their own name and also covered under another plan as a dependent under someone else's name, the plan in which they are primary, or actually listed as the insured, will be the primary insurance for that patient. The exception to this will be Medicaid, as Medicaid is the payer of last resort, always. And that will come up later. The active-inactive rule, as you can see here, is a policy which covers an individual as an active employee, is the primary payer over the policy covering an individual as retired or laid off employee. This also applies to dependents covered under two policies. So once again, anything which is the more active of the two plans is considered the primary plan. So if someone is working and is covered under an employee insurance and is also covered under, for example, a military retirement insurance, the military retirement insurance would be secondary because it is under a retirement plan rather than the active insurance that insures the employee currently. Thank you for listening. We'll continue with coordination of benefits in the next portion of this topic.